Hello and welcome to today's episode. In this video, we will explore an intriguing case of Dapsone toxicity in a young patient. We will dive into the clinical findings, evaluate laboratory results, calculate the ingested dose, and compare everything against established guidelines. Most importantly, we'll assess the treatment provided and discuss key lessons for healthcare professionals. Let's get started. Our patient is a 10-year-old male weighing 66 pounds or about 30 kilograms. He has been using Dapsone 50 milligrams daily since 2016. 2 days prior to his current presentation, he was diagnosed with pneumonia, hypokalemia, and low oxygen saturation of 88%. He was treated with an antibiotic injection, ceftriaxone, and discharged with a prescription for cephalexin. However, persistent oxygen desaturation prompted further evaluation. Upon his return, the key clinical findings included persistent desaturation without visible cyanosis, a physical examination that was otherwise unremarkable. The laboratory findings revealed a methemoglobin level of 18.1%, confirming methemoglobinemia. To better understand this case, let's evaluate the patient's Dapsone dose compared to toxic thresholds. According to established guidelines, Dapsone becomes potentially toxic in children aged 3 to 11 years if they ingest more than 1 milligram per kilogram of body weight, or more than 50 milligrams in total. Our patient, weighing 30 kilograms, has been taking 50 milligrams daily. This is within the potentially toxic range when considering the long-term cumulative effects of Dapsone, especially given the drug's long half-life of 2 to 4 days. Now let's discuss the clinical and laboratory findings. 1. Oxygen desaturation was the key symptom. Although the patient did not exhibit visible cyanosis, his oxygen saturation was initially at 88%, which is concerning. 1. A methemoglobin level of 18.1% is significantly elevated. Normal levels are below 1%, and levels above 10% often result in noticeable symptoms, such as fatigue, headache, or shortness of breath. Levels above 20% can lead to serious complications. The treatment provided in this case was both appropriate and effective. 1. The patient was treated with Methylene Blue, 2 milligrams per kilogram administered intravenously. This is the standard first-line treatment for symptomatic methemoglobinemia. Methylene Blue works by reducing methemoglobin back to functional hemoglobin. 1. Following treatment, the patient showed dramatic improvement. His methemoglobin level dropped to 3.9%, oxygen saturation increased to 96%, and his vital signs stabilized. Supportive care included oxygen supplementation, close monitoring of methemoglobin levels and vital signs, ensuring hydration to support recovery. Let's compare this case against established guidelines for managing Dapsone toxicity. Observation and monitoring. The patient was observed for persistent symptoms and laboratory abnormalities, which aligns with the recommendation to monitor patients for at least 24 to 48 hours due to Dapsone's prolonged half-life. Indications for treatment. Methylene Blue was correctly administered as the patient had symptomatic methemoglobinemia with significant oxygen desaturation. Long-term management reassessment of Dapsone therapy is essential to prevent recurrence. Alternative treatments may be necessary if Dapsone use poses a high risk. This case highlights several critical lessons. 1. Methemoglobinemia should be suspected in patients with unexplained oxygen desaturation, particularly if they are using medications like Dapsone. 1. Methylene Blue is a life-saving treatment for symptomatic methemoglobinemia, but supportive care and monitoring are equally important. 1. Reassessing the use of potentially toxic medications is vital, especially in chronic conditions requiring long-term therapy. Thank you for joining us in reviewing this fascinating case. If you enjoyed this video or found it educational, don't forget to like, share, and subscribe to the Medical Toxicology channel. Also, visit medicaltoxic.com to find useful resources in medical toxicology and poisoning care. Let's keep learning and advancing healthcare together. See you in the next episode.